Hi there, my name is Diana Becker, and I am shooting a video to show you my teaching style for the application process for the emergency nurse educator with NRSNG. I'm excited for this opportunity to do this video with you guys. I think that the program that you guys have is awesome, and I really look forward to getting to talk with you a little bit more and interviewing with you further to become a part of your team to educate nursing students and nurses who are at the beginning of their careers. So my video is going to be on triage and what triage is. So just bear with me for a few minutes while I talk, and I'll look forward to hearing from you guys soon for a further interview. So triage is the process of sorting patients. The word triage comes from the French word for sorting. So really what we're doing when we triage patients is we're sorting them into different areas to determine how quickly they need to be treated. The purpose of triage is to sort those patients to rapidly identify anyone, sorry, I have my notes over here, rapidly identify anyone who needs immediate attention. The goal of triage is to prioritize those patients based on urgency and clinical need, not upon their arrival time. Triage can be used in hospital systems, in the emergency department, or in pre-hospital settings with like a mass casualty incident or something along those lines. The ultimate goal of triage is to get patients seen by a physician. Obviously, no matter how wonderful nurses are, patients don't come to the hospital to see us, they come to see the doctors. So we want to get them back as quickly as we can. Each patient is greeted in a hospital setting by an experienced nurse, and that allows for that rapid identification of the patients who need immediate attention. It leads to improved patient flow and decreased length of stay times. The other things that are important to remember with triage is that it can set a benchmark and a benchmark. Sorry, I totally lost my place on my notes. Describing the benchmark and overall acuity of patients in an ER allows for revenue management, and then also for things like staffing ratios and those kind of things in the emergency department. So lots of good benefits to triaging, going through and prioritizing patients into 3, 4, or 5 different levels, depending on what system you're using. It's always important with all nursing practices to remember to use evidence-based practice. And some triage systems that are out there are evidence-based and others are not. But it ensures that the patient who is complaining of chest pain and difficulty breathing is seen before the patient who is there with a sore throat and concerns about strep throat, regardless of the fact that the strep throat patient was seen before or was arrived at the hospital before the patient with chest pain. So sorry for the little bit of disjointed, but I figure you want to see what my teaching style is, and from time to time I lose my place on my notes, get lost in what I'm trying to say, and so this is a pretty honest representation of my teaching style. I look forward to hearing from you guys soon, and yeah, that's it. Thanks.